COVID-19 and immunity. Our question is, has there been testing done to reveal if people are already immune to COVID-19? If so, what are the findings? If not, what may be the reasons for not doing this type of testing? This matters because immunity is always the goal for any disease, whether it be viral, bacterial, or any other pathogen. And testing can act like a compass, guiding the scientist towards a potential vaccine. Let's define the terms. COVID-19 is an infection of a new coronavirus called Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. Immunity, as defined by Merriam-Webster Dictionary, is a condition of being able to resist a particular disease, especially through preventing development of a pathogenic microorganism or by counteracting the effects of its products. Pathology of COVID-19 with some immunity lesson. So COVID-19 is a virus in the same family as the common cold and SARS. It's transmitted via direct or indirect contact through respiratory droplet transmissions. This means that COVID-19 can be transmitted through mucous membranes from saliva or nasal secretions, so your mouth and your nose. A person can get infected by having directly touched a person who's infected, or through indirect contact by touching something that a COVID-infected person had just touched, or by being too close to a COVID-infected person who had sneezed or spoken in your 2-meter radius, thereby propelling mucosa in your radius, which is why it's safe to keep a 2-meter distance, and also to do regular hand washing, sanitizing, mask wearing, helping to prevent the spread of COVID-19. Now, the signs and symptoms of COVID-19 are fever, cough, tiredness. Some early symptoms include loss of taste or smell. Other symptoms may include shortness of breath, difficulty breathing, muscle aches, chills, sore throat, runny nose, headache, chest pain, pink eye. Now, with other cold-like viruses, when someone gets sick, their body will have a response. Your body does this by creating different antibodies to fight off the infection. Antibodies are part of the humoral immunity. A specific type of cell, part of the humoral immunity, is called the memory B cell. They remain in your body to respond to an infection that the body has once fought before. A type of antibody that memory B cells release against an infection is called immunoglobulin G, IgG. These are specific towards infection. More on the next slide. COVID-19 being a viral infection, similar to a cold, will have an effect on the B cells, also similar to that of a cold, producing antibodies IgG. In this slide here, this purple cell is the memory B cell. The Y-like are the antigen receptor sites, and the green things are the antigens binding to the sites. This triggers the memory B cell to create effector B cells, and then those effector B cells create a mass amount of antibodies and flood the system with it. How does this relate to our question of has there been testing done to reveal if people are already immune to COVID-19? We're looking to see if humans are starting to create a humoral response to COVID-19 by building memory B cells to the antigen responsible for the infection. However, due to the fact that COVID-19 is like a flu or cold virus, with its tendency to mutate, developing a full immunity may not be achievable. The picture here represents a contained virus due to the hosts developing antibodies, which also can be referred to as herd immunity, which is essentially the goal for any kind of disease. Our article, COVID-19, A Clue from Innate Immunity, has 2 parts to it. So some key findings are immune-mediated damage was sometimes more harmful than the virus itself due to the systemic inflammation it caused. Toll-like receptors, the TLRs, are a family of pattern recognition receptors which recognizes the pathogen-associated molecular patterns. So they look for pattern and they activate innate immune response. The TLRs recognize the virus, issue an immune response of significant, like mass amounts of cytokine release, primarily the IL-6. Cytokines cause inflammation, and if innate immunity is working hard, which it generally is, then this results in systemic inflammation. Elevated IL-6 levels encouraged scientists to look at medications that were antagonistic to the IL-6 response, which led them to this medication, tocilizumab, TCZ, which is a medication for rheumatoid arthritis, and it's an IL-6 antagonist or inhibitor. Scientists used it to treat 21 patients with severe coronavirus pneumonia, and it showed noted improvements in their body temperature, arterial oxygen saturation, reduced C-reactive protein, and reduced oxygen demands. Second part of the article was about the complement system, which is a group of proteins, and when they're triggered, they activate different elements of the immune system, thus enhancing or complementing it. With COVID-19, complement deposits were abundant in the lungs, and therefore neutrophils and macrophages present at these deposits played a pathogenic role in alveolar damage, thus damaging the alveoli inside our lungs. This encouraged scientists to look at drugs that were complement inhibitors, and they found isiluzumab, a medication currently used to treat hematological disorders, which is blood disorders, and it's a complement inhibitor. They used it to treat 4 patients who all showed clinical improvements in the first 48 hours with a reduction in the inflammatory markers, erythrocyte sedimentation rate, and C-reactive protein. Currently, the cases worldwide are just over 46 million, and the death toll is just over 1.2 million. This blue map shows the world cases in the world. The darker the color, the more the cases. And this map shows the number of deaths. Again, the darker the color, the more the deaths. Overall idea of this article was that it highlighted that innate immunity often makes things worse for the patient because it causes systemic inflammation. Suppression of the innate immune response in severe cases has shown promising results. We concluded from this is, WHO, the World Health Organization, states there's not enough evidence about the effectiveness of antibody-mediated immunity to guarantee the accuracy of an immunity passport or risk-free certificate. People are not already immune to COVID-19. This knowledge will help us with our nursing practice going forward by providing us a greater understanding that COVID-19 can affect anyone at any point in their lives. Being aware of this will help us increase our infection control standards and lead by example by following the guidelines set out by the BC Ministry of Health. One can also be proactive in preventing their exposure to COVID in their lives. If you're a healthcare employee, ensuring you have proper PPE at your workplace when dealing with a COVID positive patient or a potential COVID positive patient. And if you're out and about, having a mask on at all times. And third, and quite possibly really important, the most important, is hand washing, ensuring you have proper hand hygiene at all times. Florence Nightingale implemented this, when she was treating the soldiers in the 19th century and had remarkable improvements in their health. And it's just as important today in the 21st century to help prevent the spread of COVID-19. Thank you.